Good morning. Welcome to the Point. This week, Governor Gretchen Whitmer will deliver her second State of the State address. And like last year, we expect to hear a lot about roads. It was in her budget recommendation where Governor Whitmer last year introduced the idea of a 45-cent per gallon gasoline tax. That went nowhere. Now we're told that she may try a different tack, maybe one that doesn't even involve the legislature. No matter what the plan is, we know it will be a major part of that speech, and as if to emphasize that, Lieutenant Governor Garland Gilchrist was in Grand Rapids last week to take a tour with MDOT. We rode along as he saw the condition of roads in our area, and later, back at the headquarters, talked with him about what he saw and what he expects. This is not a new conversation for you, obviously, something you've talked about from the moment you started running for this office, but in going around today here in West Michigan, did you learn anything new about the condition of the roads?
Well, it's always helpful to get the perspective of the engineers and the MDOT professionals who are working with these challenges every single day. And I'm just so much in awe of the work they have to do within the constraints that they're working with. I was hearing from the engineers talking about how they have to triage and prioritize these projects, how we really need to be reconstructing roads instead of just patching them year after year after year. And the more that we wait, the longer that we just patch rather than reconstruct, the more expensive the projects become. And so being able to see that up close, being able to, understand when I'm looking at a patch on the road, what does that really represent? Why is it that way? And so it really just gave me more appreciation for those professionals, but also a greater sense of urgency for why we need to fix this problem in the right way and fix it as quickly as possible.
One of the things that you saw was any number of different surfaces, different ages, all the way up to 50 years for some of these projects and some of these bridges, and how you heard from the engineers about how it gets increasingly more expensive to patch the older roads on a more frequent basis.
That's right, and the cost goes up almost exponentially. I mean, if you think about how our roads, the condition they're in right now, we have about 70% of our roads that are in good and fair condition. I mean, the state trunk line roads. But if we keep on this same path, the degradation is going to lead to twice as many roads being in poor or poor condition over the next 10 years. We have to invest in this now. And I saw with the beginnings of a road that was reconstructed in 2006, what it looks like today and what it will look like in 2030, it's really quite devastating. So we have to do something about this problem.
What is the price tag, if you have one? Because the numbers have been thrown around for years about it's going to take this many billion or that many billion, but where do you think we are?
Well, I mean, it's going to take more billion than it did last year. So we talked about during our budget conversation all last year, $2.5 billion every year over 10 years. That's a $25 billion program. I mean, well, we're 1 year later, which means it's going to be even more expensive. I don't have an exact price tag, but I can tell you that it will be more expensive than it was because we didn't take action last year. That's why we have to act now and do everything we can to at least stabilize these trunk lines that are degrading at such an alarming rate.
And finally, I know you're not going to talk about specifics, but is it within the realm of expectation that we'll be hearing a new plan for financing of these roads as we move forward into the State of the State and the budget presentation?
We're definitely going to break some news during the State of the State and during the budget presentation about how we are going to move forward and take action, because if Michiganders are driving on these roads that urgently need to be fixed every single day, we put forward a real concrete plan to fix those roads, and now we're ready to follow up on that plan because the Republican legislature, did not put a real plan on the table. They did not take serious action. And so it's up our responsibility. And so you're going to see that plan very soon.
And about that plan, exactly what will it be? Well, we don't know, but I did get a chance to talk to the governor last week and tried to get some kind of an indication from her. This is how that exchange went. Governor, can you give us a quick look at what we're looking at next week? There's a lot of speculation about what you may roll out at the State of the State.
Well, if I tell you, does it mean you won't come, Rick?
Oh, I'll be there.
Well, then you'll see. Thanks, everybody.
And of course, I will be in Lansing for the State of the State speech. That's when we'll find out what the governor plans to do about roads and all of her other agenda items. And on Friday, we found out that the governor will have another high-profile speech to make. She will be delivering the Democratic response to President Trump's State of the Union. That's scheduled for February 4th. However, the impeachment proceedings may still be going on then, so it's not certain if that date could be changed. One of the things we learned is that those impeachment proceedings may go on longer than we thought. We heard that from Southwest Michigan Congressman Fred Upton. There's a lot going on in Washington, and I know for the second time since you've been representing this area, you have watched the impeachment process from the House of Representatives, now moved on to the Senate. I want to spend a lot of time on it because it's all played out in front of everybody's living room and television sets, but give me a sense of what it does to the ability of you, and we're going to talk about this in a few minutes, about working with Democrats across the aisle, and in general, trying to get things done outside of what is that big elephant in the room.
Well, we all know what the result is of the Senate. They're not going to have a 2/3 vote. I mean, that's it's not anywhere close. I'd say the difficulty is that now that we really are in a presidential election year, already you have a limited legislative number of days because you get time off for the Democratic convention and the Republican convention and more time for folks to come home. We have a lot to do. And we got very little done really in the last Congress, and much of it happened literally in the last week or two. At least in the House, we passed USMCA, which was strongly bipartisan, and the Senate passed it this last week. 90 votes, I think. Both of our senators voted for it. Most of the Michigan delegation, Republican and Democrats, voted for it. Nearly 400 votes in the House. So it's just the Senate now, by rule, they have to be on this thing for however long it takes. It could take a month. So you got the budget that comes up, the appropriation process, you got all the things that you got to do normally already in a more confined space because you have less legislative days. And I have watched very little of the debate in the Senate. I've been, I don't have time to sit and watch. But you already have a division, going back to your question, often between the House and the Senate. The House members think the Senate's a little bit uppity, to say the least. And now you've got everyone has to sit in their seat. They can have milk or water, no coffee, no phone, no device. Can't go to sleep for 12, 14-hour days listening to this. And my sense is, though I've not talked to any senators, the resentment is probably getting higher. So cooperation, things that we need to do, particularly in divided government, more difficult.
You mentioned something that we talked about on Mackinac Island in the fall. In fact, you got an opportunity for us to talk with your leader, Kevin McCarthy. And he said then that he believed that the votes to pass the new trade deal, the USMCA, were there if Speaker Pelosi would allow the bill to come to the floor. And at that time, it seemed to me like that might not happen. But in whatever turn of events that happened, on the same day that she announced impeachment hearings would go forward, she announced the USMCA would come to a vote. And as the leader pointed out, the votes were there. So no matter how it came about, what did you think that means for Michigan? Because we know that the NAFTA agreement that it replaces had some maybe positive, but did have some negative impact on Michigan businesses. This
new bill, and the president didn't like the word NAFTA, the acronym, the North American Free Trade Agreement. He liked USMCA, United States, Mexico, Canada. This bill was always going to do, once they got the agreement, and they had the agreement literally a year ago, it was going to be a positive for Michigan. The votes were there overwhelmingly to pass it. Not only when you talked to Kevin McCarthy in September, frankly, they were there in the spring when it was formally announced. Both countries did the deals, and we had nearly 400 votes in December. What it did was it delayed us improving NAFTA. Now, how did I look at it? Two big things. One was agriculture, and for a lot of years, we have been discriminated against on the dairy side. We've had thousands of dairy farms closed, particularly in the Midwest, Wisconsin, Michigan, New York. Canada had a really pretty good deal for their folks and took advantage of us. On the manufacturing side, and a lot of parts manufacturers for sure, but we actually raised the percentage of North American domestic production that now has to be there to be tariff-free. So who does that help? Us. Because all those parts that we're making all over our state, all of a sudden, Ford, GM, Chrysler, and they've got to qualify, they've got to have more domestic production, which again helps us, which is why both our senators voted yes when they took it up only last week, as well as, again, most of the Michigan delegation, and frankly, most of the Congress. The problem was that by delaying it, in essence, a year, cost us the tens of thousands of jobs that we could have had last year that are now delayed until literally as the president signs it just in the last day or two.
When you look at the rest of this year, and you had talked about some of the things that you wanted to try to get done, is it going to be possible? I mean, the impeachment process will be over, as you say, in 3 weeks or however long it takes. When that's done, and in that now shortened window, again, because of the elections, is it going to be possible for Republicans and Democrats in the House and Senate and everybody to say, okay, that's behind us and we're going to move on with important things that you're talking about, including, I know, one of your initiatives that we'll talk about in a minute?
Well, we have to. I mean, we have divided government. We're going to have divided government after this next election. You're never going to have a 60-40 advantage like President Obama had. It's always going to be pretty narrow. And we have to put this behind us. I mean, one of the things that our Problem Solvers Caucus did, remember this is the bipartisan caucus, nearly 50 members. The day of the impeachment vote in the House, we all knew how the vote was going to be. But let's get together. Let's us just get together for dinner and talk about things that we want to work on and really put this behind us. No barbs, no knives. Let's just, what is it that we can do knowing that, I didn't run to be a puncher and a fighter. I ran to get things done, and so did virtually every other member of the Problem Caucus to do that. And we've had some successes at the end of this last year. We did a major immigration agriculture piece, something that my Farm Bureau members have been screaming about for a long, long time. We're working. We had a conference call this past week now for an hour. Republicans and Democrats on the phone for an hour, talking about AUMF. Everything has an acronym: NAFTA, USMCA. AUMF, of course, stands for the Authorization for the Use of Military Force, something that's been around since 9/11. The president used it with the Soleimani attack in Iraq. I'm one that believes and have voted to say it's time to renew that, or let's re-examine that. It shouldn't be there 20 years later. We're working with the White House, with Republicans and Democrats to see what we can do to upgrade that from where it was before. We've got other issues, whether it be prescription drugs, whether it be gun safety, again, in my view, protecting the Second Amendment, but actually doing some things that will stop some of this violence that is so abhorrent. So the agenda is a long one. We have to talk fast, maybe faster, to get things done, but we're at the table, we're engaged, we have access to the leadership, to the White House, and you'll see that continue.
You talk about the Problem Solvers Caucus. You and another member of the House here in Michigan, Congresswoman Dingell, have worked together, you've talked together, you've traveled around together and talked about trying to come up with common goals. Is there a broader sense? Because let's face it, the members that end up on television every night are the ones who have the biggest bombs to throw.
Yep.
Nature of the beast. Are there more people, you and Diana DeGette, for example, the Congresswoman from Colorado who worked at 21st Century Cures, are there more members that take that approach, or is the polarization as high as it appears to be?
The polarization is way up here. Remember, I started working for President Reagan. You didn't have 24/7 news, you didn't have any of these things. It is a lot worse than ever before, and certainly the public, that's what they see, which is really tragic. I mean, you watch what's happening now in the impeachment, and one station is going to be different than the other, and people go to their corner. They watch where they are, which frankly increases, I think, some divisiveness. I talked to Debbie Dingell this last week now, probably 3 or 4 times. We're going to actually do, I think, a platform this coming week as Congress comes back with votes Monday. But later, we're going to be together on a panel that The Hill, that's one of the major publications, Politico, The Hill, Roll Call. We're going to be doing a major panel a little bit later this week talking about bipartisanship, talking about civility, and where we can work together. Debbie Dingell and I are both co-chairs of this group, Democrat and Republican. Lisa Slotkin from Lansing, she's a member of the Problem Solvers as well. So it's a pretty good, well-balanced group. We've got members that want to join. They've seen what we've able to do, particularly as you look at what, we tackled the tough issue of immigration and again passed that bill by nearly 100 votes this last month in December. So there's room, and our group of 50, our elbows are on the table. We can get things done without being mean-spirited.
And the congressman says there are a lot of things he'd like to get done in what will be an abbreviated session. We'll talk about some of those when we come back to the point. Welcome back to the Point. Congressman Fred Upton says there is an opportunity to get some things done in Washington, and one of the things that he would like to get done is a continuation of one of his signature pieces of legislation. Let's talk about some of those things. 21st century cures. And for people who don't know or don't remember, you and I have had this conversation now for the better part of 3 years, from when you started working, again, in a bipartisan way, on a piece of legislation that helps get medical treatment and devices to the market more quickly, because in other parts of the world, they can get that treatment approved more quickly. And this puts us at a disadvantage, and it also puts people who are waiting on those treatments at a disadvantage.
That's right. And we also coupled it with $45 billion more dollars for health research. So things like sickle cell and stage 4 pancreatic cancer, SMA, spinal muscular atrophy, all these things now have more cancer, obviously, more research, and we're able to streamline the trials, use, the internet and, a whole number of different things that we didn't have before. And literally we had a meeting just before so I've been home for a week. Literally the last day of the previous week, a number of us, Republicans and Democrats, sat down with HHS, Health and Human Services, and they talked about some of the advances, not only that we've seen the last couple of years, but also now we're beginning to work on what we call 2.0. And we have more than, for the last couple of months, we've been soliciting ideas. We have more than 400 ideas from the National Institutes of Health, from HHS. We sat down with the Center for Disease Control director for a good hour the other day. They're coming up with ideas. Of course, we have this terrible thing now that's happening in China. I mean, God help us if it spreads much more. What is it that we're doing? All of these things will help us as we look to upgrade 21st century cures, and obviously do it in a bipartisan way. We've reached out to the leadership on both sides of the aisle, beginning to have some discussions with the Senate. But this is one of the things that we need legislative days. We need to listen. We need to understand what we're doing. We want to make sure that these drugs and devices are safe, that nothing gets to the marketplace that's otherwise. And that's why a shortened legislative calendar hurts us to try and get a bill to the president to sign.
In the last incarnation,
took us 3 years, remember,
right,
on the last bill from start to finish.
Right,
and literally it was the last bill that President Obama signed into law.
I remember the conversation because you were uncertain if it was going to get done.
Yeah,
by the time
we had to work Thanksgiving Day, interrupt, all the things to make sure we got. But we were that close, but we needed every hour to get it done before it was over.
When you work on a bill that big, and now when you work on something that you can say, this is what we did before, Republicans, Democrats, Democratic president signs off on it, and here's what the experts are saying it does. Does it make the second go around a little easier? I know it's still complex.
I hope so. I serve on the health subcommittee, and I tell you, there's not a hearing that we don't have. There's not a hearing that someone on the dais, Republican or Democrat, doesn't talk about 21st century cures and what we intended to happen. So whether it's opioid abuse, whether it's drug prices, I sat down not too long ago with a private pharmaceutical company, and they are now in the development of a stage 4 pancreatic cancer drug that shows real promise. Already the survival rates are not the 5%, which is today, but maybe 70 or 80%. And they got to get through the next logjam, and we're trying to shorten the time, knowing that it's so promising. And if it's successful, we'll shave years. I mean, we all know someone with pancreatic cancer. I've got a friend who literally had a 7-day notice from when she was discovered to when she passed away. With MS, all these different things. We've seen, 60 Minutes this last week ran a rerun on sickle cell. We've actually found the genetic cure for that, in large part because of what we did with 21st century cures.
Finding the cures is one thing, being able to afford them is another. And you talked about that a moment ago. Governor Whitmer was talking about it this past week about what to do about prescription drug prices. Getting access to the drugs that can make people feel better or keep them healthy in the first place is a real problem for people who are uninsured or underinsured or perhaps working a couple of jobs and they can't meet the copays and all of those different problems. That feels like a federal issue.
Yeah, and we've done some things. First of all, there was good news just in the last day or two. Blue Cross has come out with some new, I'll call them guidelines or incentives to reduce drug prices, perhaps by double digits. But second, the other thing that we did was really worked to get some of these drugs through the generic industry. You know, they got the patent life. You know, just in our district, Allegan County, largest employer, of course, is Perigo. What is it that we can do to get these drugs faster using the generic side of things? And of course, by shortening the time frame to getting approved, that'll, you know, it costs about $1.5 billion to get a drug approved. If we can reduce the time, we also reduce the cost. Of course, in Michigan, it was Governor Snyder, continues under Governor Whitmer, for Medicaid expansion. Another way that we can make sure that folks who are less able to afford some of these more expensive drugs, in fact, will have access to it. And we've tried to fix the donut hole as well. So this is, again, Medicare Part D, something that I supported back when President Bush, 43, the last President Bush, was in office. His big issue, of course, was what can we do for prescription drugs for Medicare. We passed it, and we're again making some accommodations to make sure that more people are covered at a lesser cost to them.
When you think about the cost of drugs, and I get it, these are companies that have expenses, they have research, they have all of those things.
And we want that research here,
right? Because
that creates the jobs here.
But is there a negotiating stance? I mean, look at the federal government and your role in healthcare, and at this point you can't negotiate, you know, on prices. Is that something that has any traction or any promise?
Well, it's a huge issue, that is for sure. Sadly, the House passed H.R. 3 this last month. Very little, maybe one or two Republicans voted for it, but if it somehow came to fruition and the president announced that he would veto it, it would actually stop virtually the new drugs, a lot of the research, and you know, I don't know if it would ever get it done, let alone, you know, whether it be sent overseas. We had something I worked on, a Republican proposal that we took every bill that we had done on a bipartisan basis. And when I say bipartisan, it's not one or two Democrats, it was at least half of them. In some cases, all of them. We put them all together. We said, the president will sign this. This will actually reduce prescription drug costs. So let's take this away as an issue where people point fingers at each other. You did this, you did that. Actually sign something that we can get through the Senate, the president will sign, and do it today. We offered that as a substitute. We didn't have the votes. We got some Democrat votes, not a lot. But you know, this issue is probably not now going to happen. I mean, we're going to, again, our problem solvers are going to look at putting together some of the pieces, probably come back to that. Maybe there's time this legislative year to try and do something, but we'll see.
For now, at least, impeachment is the focus in Washington. But when that process is over, Upton is hopeful that some things can get done. We'll have to wait and see. We'll be back with more To the Point in just a moment. It will be a busy week in Lansing with the State of the State address and the legislature really getting underway. We'll be following that and also keeping an eye on what's going on in Washington. Hope you'll join us every Sunday morning at 10 for To the Point.